Dear committee, dear audience, my name is Regina Molnár, and I would like to introduce you to our projects in the context of new insights into the development of abnormal glucose tolerance and cystic fibrosis. I'm a PhD student at Translational Pediatric Institute, and my supervisors are Andrea Parnitsky and Klementina Oczkai. My vision is that one day cystic fibrosis-related diabetes will not worsen the life quality of CF patients, and my mission is to provide a new screening strategy for an earlier diagnosis of an abnormal glucose tolerance in CF. Here you can see the list of our ongoing projects, which are strongly related to each other and investigate the role of islet autoantibodies in cystic fibrosis-related abnormal glucose tolerance from different aspects with different methodologies. Why did we choose this topic? Because, as we've heard before, cystic fibrosis-related abnormal glucose tolerance is the most common extrapulmonary complication of CF. It affects approximately 1/3 of adolescents and half of the adults. Besides worsening the life quality of the patients, it significantly increases the overall mortality rate. And this you can see on this figure, where the blue column represents the mortality rate of CF patients with diabetes. An abnormal glucose tolerance can begin in early childhood, and from ferret studies, it's described that an endocrine dysfunction of the pancreas can be present even at birth. This is mainly due to physical damage to the pancreas with bystander beta cell death, and with destruction to the beta cells, originally intracellular autoantigens are released. And this activates the immune system. On one hand, it results in the expansion of autoreactive T and B cells, and on the other hand, there is an abnormal inflammatory response due to chronic inflammation characteristic of cystic fibrosis. And last but not least, in cystic fibrosis, neutrophilic inflammation is very typical, and with the prolonged activation of neutrophilic extracellular trap, this together drives the development of an autoimmune setting. In type 1 diabetes, the role of islet autoantibodies is well established. According to the TEDdy study, approximately 34% of children with islet autoimmunity develop type 1 diabetes in time. However, in cystic fibrosis, screening for islet autoantibodies is recommended only in special cases and with just a theoretical E level of recommendation, therefore not commonly used. Because of this, data on the role of islet autoantibodies is missing in the CF population. So with our first project, our aim is to determine if islet autoantibodies contribute to the development of an abnormal glucose tolerance in cystic fibrosis. For this, we are investigating the prevalence of islet autoantibodies in CF in the form of a systematic review and meta-analysis. And our clinical question is, does autoimmune beta cell damage play a role in the development of abnormal glucose tolerance in CF? Our population is cystic fibrosis patients with a measurement of one or more of the following 5 islet autoantibodies characteristic of diabetes. And their main outcomes include the age of onset of an abnormal glucose tolerance and the presence of one or more of the above-mentioned islet autoantibodies. Our hypothesis is that islet autoantibodies are present in a significant proportion of CF patients with an abnormal glucose tolerance. Implications of this study would be, from a clinical point of view, to provide a tool for an earlier screening strategy, for policymakers to emphasize the use of autoantibodies, and for future research to discover the underlying autoimmune pathways. We've conducted a systematic search in 4 databases with the following search key in the middle of November, and altogether found 1,723 records. After duplicate removal, 1,320 records remained, and after title and abstract selection, 57 articles were eligible for full text selection. In the end, 22 full texts were included in data extraction. In this part of the process, Blanca Bodi was my selection pair, and here you can see the Cohort kappa for both parts of this selection. So to summarize where we are in the progress with our first project, so far we have completed the data extraction due to the small number of included studies, and just handed over the raw data for statistician colleagues. So let's move on to our second project, where we are investigating the role of islet autoantibodies in the development of abnormal glucose tolerance in the form of a registry analysis. As I previously mentioned, screening for islet autoantibodies in cystic fibrosis is limited, and according to the same guidelines, screening for an abnormal glucose tolerance is only recommended from 10 years of age. Therefore, data on the role of islet autoantibodies is not just missing from the adult CF population, but from the pediatric CF population as well. So with our second project, our aim is to assess the effect of islet autoantibodies on the development of an abnormal glucose tolerance in children with cystic fibrosis. For this, our clinical question is, do islet autoantibodies influence the development of abnormal glucose tolerance in children with cystic fibrosis? And we are comparing cystic fibrosis children with islet autoimmunity to cystic fibrosis children without islet autoimmunity, and looking for the glucose tolerance status and the age of onset in case of an abnormal glucose tolerance. Our hypothesis is that CF-related abnormal glucose tolerance is more frequently present in children with islet autoantibodies and develops earlier. Implications of this study are quite similar to our first one for clinicians to provide an easy-to-use tool for an earlier screening, for policymakers to broaden the use of autoantibodies in the guidelines, and for future research to discover the pathways. In this study, we are including children under 18 years of age with a diagnosed cystic fibrosis and with available oral glucose tolerance test results and blood samples. As data source, we are using the previously mentioned cystic fibrosis-related pancreatic disorder registry, which was started in 2018 at Heimpál National Pediatric Institute, and today approximately 100 children are included in the registry and followed regularly. What I like to highlight from the registry's structure is that one of the unique features is that we have data on the glucose tolerance status of the children, and there is a biobank with available blood samples for further analysis. So to summarize our ongoing projects, we are investigating islet autoantibodies in cystic fibrosis-related abnormal glucose tolerance, first in a form of a systematic review and meta-analysis to see what is known in the literature, and as a second project, the same concept in children in whom data is scarce to this day. I'd like to thank you for your attention with the words of Gessler. Children are not things to be molded, but are people to be unfolded. And thank you very much for your attention.
Congratulations for the nice presentation. The first question is mine. The last year we started giving new drugs for treating cystic fibrosis.
Yes.
Is the literature, or do you know, will change the pancreatic function connection with the diabetes, or in this topic after using these new drugs?
Thank you for your question, Professor. Actually, as far as I know in the literature, it's an interesting and hot topic to investigate the modulator therapy's effect on cystic fibrosis-related diabetes. However, since they are quite new, there is no exact data on the effect. But according to small studies and preliminary results, we see that in children who has at baseline has stool elastase level above 200 microgram per gram, the exocrine function of the pancreas can be restored or has a beneficial effect. The modulator therapy has a beneficial effect on that, and it can cause a beneficial effect on the endocrine function as well. And in our registry population, we see that those children who are on insulin treatment and on modulator therapy as well, they have a better control on their better glycemic control.
Thank you. We will see the future.
Yeah.
Yes, please.
Congratulations to your excellent presentation. My question is that why did you choose to test for these 5 autoantibodies?
Thank you for the question. We chose these 5 autoantibodies based on recommendations of the guidelines, and these are the autoantibodies recommended according to diabetes guidelines to screen for and most frequently screened. And we definitely wanted to include more than one islet autoantibody because positivity for multiple islet autoantibodies is a better predictor of the risk of developing diabetes than just positivity for one islet autoantibody.
Thank you.
I connect to the previous question. Do you think there is difference between the autoantibody profiles between type 1 diabetes mellitus or cystic fibrosis-induced diabetes because the loss of beta cells? What is your opinion about? I don't know.
Me neither. Thank you for your question, first of all. As far as what I read in the literature is that there is, especially on the CF children, there is no data on the profile of their islet autoantibodies, but...
and in adults?
Neither.
Neither.
But it can be, but as far as I read, these islet autoantibodies can be transient in the children, for example, and in the levels there can be differences as well. So, for example, the autoantibody levels can rise, but that which one, it's written that autoantibodies against insulin are the ones typically present at first or earlier. However, these levels tend to fall in a case of hyperglycemia. And however, it's also written in some studies that autoantibodies against the glutamic acid decarboxylase can remain increased. So we are interested as well to see their profile.
Thank you. Thank you very much.
Okay. Yes, please, the last question.
My question is about the first project.
Yes.
Do you plan any subgroup analysis in that project?
Yes, thank you for the question. Actually, we do. We plan to do a subgroup analysis based on the age and the different glucose tolerance status to assess better the differences in the prevalence between patients with a normal glucose tolerance or pre-diabetic conditions such as impaired glucose tolerance, impaired fasting glucose, and indeterminate glucose tolerance, and of course with the cystic fibrosis-related diabetes representing the end point of the spectrum.